that this number of samples had exceeded their temperature thresholds. As a result of that, those sites are receiving replacement vaccine today and tomorrow for those 4,400 doses. Again, those sites will be receiving replacement doses that are on their way and will be delivered today and tomorrow. Operation Warp Speed and the US CDC are investigating how and why this happened. We learned earlier this morning that Maine was not the only state to have received shipments of Moderna vaccine where there were these exceedances of temperature. That process to investigate why this happened at the site of whether it was at the manufacturer or at the shipping process, we will learn more about as that investigation by Operation Warp Speed unfolds. This was not something on the Maine CDC or state of Maine side, but rather something that occurred during the packaging and shipment of the vaccine. Let me say this. Right now, we are asking all of the locations that received a shipment of this Moderna vaccine that have these temperature exceedances to separate that vaccine so they don't use it. We are working with the US CDC and the manufacturer, Moderna, who will analyze scientifically whether that vaccine can ultimately be used or not. More information will be coming on that. But in the meantime, as I mentioned, replacement vaccine is on the way. Some doses have already been delivered, others will be delivered tomorrow. Our goal among all of this is to make sure that vaccine that comes into the state is safe, effective, and viable before it goes into any arms. And I'll close by saying this. This news is concerning, but it's important to note that this is how the system works. There are numerous checks along the way to ensure that when a vaccine arrives, it is both safe and effective as well as viable. And that if at any point in that journey of vaccine from the site of manufacturer to someone's arm here in Maine, the shipping, handling, and carrying conditions are not optimum, that there are processes in place so that we know that and so that the vaccine is not given to somebody. It's always unfortunate when logistical issues of this nature crop up, but it's also good to remember that the system has these safeguards in place so that if they happen, we know about them immediately. So with that, I'm going to turn things over to our colleagues in the media. And the first question today goes to Jessica Piper from the BDN.
Hi, Dr. Shah, thank you. The Maine CDC put out a list yesterday on its website of vaccine sites for older individuals who might get the vaccine through phase 1B. And I was wondering if you could talk a bit about how those sites were determined and when we might see additional ones in parts of the state that don't have one right now.
So Jessica, I want to start by noting a few things. The first is, we are moving into phase 1B now, but there are still folks who are in 1A, frontline healthcare providers, law enforcement personnel, who are still in the process of being vaccinated. So we are still simultaneously working on both, wrapping up with 1A or moving our way through 1A as we now start turning up the dial on phase 1B. The second thing is that you sort of noted this or framed this as sites that were determined. That's not how this came to be. Maine CDC has worked, and DHHS have worked with a number of vaccine providers such that those who had phone numbers ready to go and were able to schedule patients, we could then have confidence in putting onto our website. So it wasn't as if we deemed these the places to go. As more and more providers become ready to open up their doors to their patients and others, offer vaccine, for example, to those 70 and over, we'll make sure that their contact information is on the website. So this process will go on. We also know that folks, given that yesterday was the very first day, may have had trouble getting through. It's a great sign that there is so much robust demand for vaccine in Maine. Unfortunately, we are at a point right now where demand exceeds supply. One of the corollaries of that is that for a little while, it may be tough to get through. We ask that you bear with us and bear with those hospitals and clinics. Don't get upset with the person on the line when you finally get through. We are all trying to ramp up so that eventually folks will get vaccine. But we are in a situation where there is more demand than there is supply. We projected that these sorts of things would happen. We're trying to make sure that we can get as much capacity as possible. Commissioner, anything that I forgot there?
No, just that we ask people to be patient. We appreciate the frustration, and we're frustrated as well. We really do wish we had as much vaccine here in the state of Maine to meet what we consider great demand. We are so excited that people in Maine share our trust in this vaccine. They want to be protected. They want to be able to do what we're doing, which is ensure, first of all, our critical health infrastructure is protected. And second, we're vaccinating those people who are at greatest risk of severe illness or death. So we will work our way through it. As Governor Mills has said, we'll get to everybody and we'll get to them as soon as possible. We just ask a little bit of patience. This sort of startup challenge is to be expected, but we'll get there.
Yeah, thanks to both of you. And then Dr. Shah, you mentioned kind of you're still simultaneously doing 1A and phase 1B. And I'm wondering if kind of in the short-term future that you guys are planning, how many vaccines are going to be distributed through each of those different pathways? And are there particular sites that are going to get them?
Right. So Jessica, it's not as if there are certain pathways or sites that are designated as only 1A or only for 1B. What we've seen across Maine is that providers, be they outpatient clinics or hospitals, are able to do both. There are some providers now that have started opening up their doors to those 70 and over. I received a report yesterday from one such clinic in Portland that indicated that they vaccinated in one day some healthcare providers in their area, as well as a person who was in their late 90s, who was a patient. So there are providers that are able to do both. It's not as if there is a dedicated channel only for healthcare providers and a separate designated channel for those, say, 70 and over. We've seen across the state that providers are able to blend in whom they are vaccinating, given that we're transitioning, still wrapping up with 1A, which will still take us a while, but again, simultaneously turning up the dial on 1B.
Yeah, and that strategy of trying to have these overlapping phases is part of the reason why Maine remains highest in New England in terms of the percentage of shots in arms. That's because we want to make sure when the vaccination gets out there, we identify people quickly and we get those shots into arms as efficiently as possible. And that sometimes means making sure that all the available people who are eligible at this particular point in time can get a vaccine at a particular site.
Thank you.
I'm going to turn now to Ashley Blackford over at WAGM. Ashley?
Hi, sorry about that. My question, a professor at the University of Maine at Presque Isle does a Maine COVID-19 daily situation map where he really breaks down the numbers. In it, he has started to report the estimated active cases with going by the difference in total cases in a 12-day interval. He posted that it's determined after careful examination of the recent data and consultation with medical experts. He says in the post that it is found to be the most approximate of true active cases. I'm wondering what your take is on this, and the active cases that he's reporting are significantly lower than what Maine CDC is showing.
Sure. So I am familiar with that visualization. I believe it's Professor Wang who has done those, and I found them to be quite illuminating, and I thank him for his ongoing efforts. If I recall, the professor has done so pretty much every day. Active cases, Ashley, and I mentioned this a few weeks ago, it's not a term that is in use really when we think about COVID that much. For other infectious diseases like tuberculosis, it's something that is more openly discussed because there are tighter parameters around what constitutes an active case. With COVID, really the way that we think about it from a very macro epidemiological scale is that there are folks who have not had COVID, there are folks who have recovered from COVID, and somewhere in the middle are folks that are grappling with it. But what that tight parameter is not really something that's well defined. And so that's one reason, for example, you don't really hear me, you've never heard me during these briefings, remark on the number of active cases in Maine, because there's not a really strict clinical or epidemiological definition for it. There are definitely hypotheses, but none that the US CDC or the World Health Organization, so far as I'm aware, have really endorsed in the way they have for something like tuberculosis. I absolutely respect the analysis that the professor has done. Not that I disagree with it, but we don't really have a way, I don't really have a position to say whether our numbers are different or whether the professor's numbers are superior. As we have changed the way that we've done case investigations over the last 2 months, 3 months, our insight into when folks are no longer considered infectious with COVID has changed. And so that's why we don't have those numbers sort of every day. I'm going to turn over to Joe Lawler next.
Yes, hi, sorry about that. A couple of questions. The first comes from a reader. Phase 1B also includes people who are in their 60s with high-risk health conditions, but there doesn't seem to be a way to sign up yet. Can you clarify, what about these folks? Are they just going to be waiting another week or two, or can you explain that?
Sure, I can start, but Joe, they are thought of as part of 1B, but given that we know that those who are 75, 70 and older, rather, are at the highest risk of complications, morbidity, death from COVID, that is where Governor Mills and our team have chosen to start. Those individuals are considered, but for right now, the focus is on those who are 70 and older.
And that's primarily because in the state of Maine, there's about 193,000 people who are age 70 and older. As a reminder, last week we got for allocation this week 18,000 doses of vaccine. So it will take some time to get through the 70-year-olds and older. We will then go to people ages 65 to 69. We will then look at that category of people at medical risk. The US CDC has a definition. Here in Maine, we'll do a good hard review of the definition to see if it works for our population and begin that process. But we will make those determinations when we get closer to the time. Hopefully, again, the vaccine supply will increase and we get there sooner than we think. But in order to prevent long lines and frustration, we're starting with the older Mainers, 70 and older, then going to 65 to 69, and we will then turn to people with medical conditions to be determined.
Okay, thanks. And I think you said before, sometimes on Tuesday, you hear about what the vaccine supply for the following week will be. Do we know yet? Is there going to be an increase or about the same?
Well, a little bit of both, Joe. So we have heard some preliminary numbers, but given the discussion I just mentioned with respect to Moderna, we're waiting for those to be finalized. And that is underway. Our immunization program is having conversations with Operation Warp Speed right now to make sure that all the numbers are correct and that Maine doesn't get shortchanged next week because of this logistical challenge that has arisen with Moderna. But what we've also separately and simultaneously been told is to expect that next week and perhaps even the subsequent weeks allocations will be largely flat, or if anything, a very small, low single-digit percentage increase, but not to expect significant increases. We're confirming that with the incoming administration, but based on what we were told yesterday as well as on Friday, we're not planning for a significantly higher increase.
Okay, if I could just quickly ask one more thing. Is there any indication on how FEMA will help? I know the Biden administration has discussed this and how it would help in Maine.
We haven't received direct communication around that. Similarly, we're working with the incoming administration to learn about what their plans are. I've spoken with Director Rogers at MEMA here to touch base with him because he too has started to have those discussions. But we are waiting to see what the exact plans are going to be. As of right now, we're waiting to see after tomorrow and after the administration is in place what their plans will be. I'm going to turn it over to Rose at the Maine Monitor.
Hello, thanks for taking my question today. I've heard some frustration from at least one county EMA director that emergency management agencies haven't played a larger role in the vaccination effort. And he was saying that the current plan is kind of disjointed with hospitals, pharmacies, and ambulance services all trying to vaccinate different groups of people within the same county. And so I just wondered what your reaction would be to that. What's your response?
Well, I understand the concern. It's one reason why the week before last, I made sure that I had spoken directly with all 16 county emergency managers to let them know exactly where we are and where we're going. I laid out exactly what our concept of operations was, what we look to be working with them on, how we could be working together. And I've kept in daily contact with Director Rogers at MEMA, who is the primary liaison to the emergency management community. Director Rogers and I talk at least once a day, if not multiple times per day, so that he is aware of what's going on and can relay that back to the team. I will also say that our teams, our district liaisons across the state of Maine have frequent calls with emergency managers across the state. Our district liaison in York County has been convening weekly calls with emergency managers since the beginning of the pandemic. So we understand that we all are looking to accelerate our plans as quickly as possible, and that from certain vantage points, it may seem as if there's multiple people doing the same thing. That's because in any complicated planning process, we want to be planning in parallel. I want to be planning for site A as well as site B in case site A falls through. I want to have, if we're vaccinating law enforcement, I want to make sure that we have a team ready to do that and a backup team for that. So I understand that folks think that there might be multiple processes going on, and that's because in the midst of an emergency, I don't want things to drop. So that's where we're at.
And I'll add just a reminder that the way that the federal government set this up to date was that it's being funded through an insurance model, that the only way for an emergency medical service or a hospital or a doctor to get paid for the cost of administering a vaccine is by billing Medicare or Medicaid or private insurance. To date, the state of Maine has gotten basically no funding to be supporting this. We expect to get some funding, hopefully this week, from the coronavirus relief package that Senators King and Collins advanced back in December. That funding will hopefully come this week, but it won't be enough for us to be supporting this. So we are going to be working with our healthcare systems, which are used to this type of financing model to provide vaccine. So part of the reason why we're setting this up this way versus previous and past efforts, which have often been based in the public health system, is because that's the way this got set up by Operation Warp Speed to begin with. That could change with a new administration. There may be more support for different types of vaccination centers in the incoming administration. Some of those ideas were outlined by President-elect Biden last week. But just as a reminder, we are also dealing with a major vaccination effort that the state of Maine to date has gotten no funding for.
Rose, I'll wrap up by saying this. We have absolutely benefited as a state from the partnership that we have had with county level emergency managers across the state, top to bottom, east to west. And we stand ready to continue working with them. We will need their assistance and support. They understand their communities and counties exceptionally well. And so when we make decisions about where and when we might be vaccinating folks, we don't intend to do so without making sure that that works for them. We've done that all along. We'll continue to do that going forward.
Great, thank you very much.
I'm going to turn it over to Amy Brown next.
Thank you, Dr. Shah. I think I actually have one question for each of you today. Starting with you, Dr. Shah, just to be clear, none of the vaccines that exceeded the recommended temperature had been administered, right?
Correct. That is correct, Amy.
And was this an issue with a specific courier? I mean, are they being sent by FedEx or UPS, or is it special medical courier? How does that work?
We'll check and let you know. At this time, we're just trying to understand kind of what went wrong or how this started to be from the very basics at the manufacturing facility, and then thinking about the distributor and then the courier. Operation Warp Speed and the US CDC are leading that deep dive, but we'll get back to you and let you know exactly which courier or couriers were involved.
Great, thank you. And Commissioner Lambert, I think you spoke to this in the past, but now that the website is online, I just want to follow up. Are healthcare providers reaching out to their patients that are 70 or older by phone, or how does that work? Will people who have internet access be at the top of the front of all the lines for vaccines, or how do people who don't have internet access or skills get in line?
So we are at the beginning phases of vaccinating the general public in Maine, starting with older Mainers. It'll be a mix. Some healthcare systems will be reaching out by phone, by email to their members to give them the information that they could use to sign up. We are also committed to putting on our website both phone numbers as well as websites where people can go. And over time, especially as our supply increases, we're going to be working with other organizations like AARP in Maine has offered help to find people. Our AAAs, our area agencies on aging, are great partners to find older people who may be homebound or otherwise have transportation challenges. So we will be layering on top of the system that we've just begun this week, more and more options to make sure that we are not just quickly and efficiently vaccinating Maine people, but equitably doing so.
So that'll be done for the folks who are 70 or older before moving on to the second phase of 1B?
Again, we're going to start with 70 and older, then we'll move down to age 65, and then we'll work on those definitions of who is medically frail. Going back to Governor Mills' directive is to really try to prioritize those people in Maine who are at greatest risk of serious illness or death.
So no particular time frame though for getting the AARP and area agencies on aging involved in the outreach?
Those conversations are just beginning because, again, we just moved into this phase this week. Our supply is very limited, so it will take a little bit of time before we really turn up the dial to make sure that we've gotten everybody who is eligible to be vaccinated in, but we're hopeful to be able to do that in the coming days, if not weeks.
Great, thank you.
Thanks, Amy. I'm going to turn it over to Connor at WABI.
Dr. Shah, thank you. A couple of questions. I know Jessica kind of touched on this with the first question this afternoon, but we've heard from a number of older folks since the announcement of scheduling COVID vaccines, and there seems to be some confusion and some frustration. Some seniors may not have access to the internet or they don't know how to use it. Some of these people say they've called into the 211 number for assistance and say they've had no answers. So I guess what are some tips, maybe bits of advice you would have for these people who want to schedule their vaccine, and how have any of these types of complaints made it to your desk?
Sure. So Connor, the first thing I will say is to thank them for their desire to be vaccinated. That's the most important piece. It's great that we are in a state right now where there are so many folks that want to be vaccinated. It's unfortunate that we don't have the vaccine for every single one of them today. What I would offer and recommend that they do is first to keep calling, but recognize that they are one of several folks out there right now who are trying to get through to phone lines that for a small period of time may be overwhelmed. This is just an unfortunate consequence of there being such a high demand for vaccine and such a small supply. So, well, the first recommendation would be to recognize that many folks will be contacted, as the commissioner just mentioned, perhaps by their healthcare system. We're aware of a number of clinics and hospital systems that are proactively reaching out to their patients in certain categories to let them know how they can schedule a vaccine, whom to call, the best times to call. So the first thing to do is to recognize that you may get a phone call before you were able to get through. If you're not able to get through, find times during off hours, early mornings, close of the business, when there may be a little bit less demand on the phone lines themselves. And the third, and this is the hardest one, is that I ask everyone to bear with us a bit. Again, we are in a situation where the phone lines have just opened up. It's expected, unfortunately, none of us like it, but it's expected that there will be more phone calls than there are people to answer them. That process may take a little bit longer before that wave, that initial number of folks works their way through. How long it will take, we're working with healthcare systems so that their call centers can address that capacity. It's unfortunate, we recognize, but we ask everyone to bear with us just a bit longer. There will be vaccine available. It's just a question of getting through that in an orderly way so we don't have lines of people or that we don't have long parking lots full of folks waiting to navigate their way through. We want to do this in a controlled fashion so we avoid those scenarios where folks are just scrambling into a location without any sort of order and potentially spreading COVID there.
Thank you. Now, just the second question, kind of switching gears a little bit. Independent pharmacies are ramping up efforts to administer vaccines across the country. Are there plans for other pharmacies in Maine to join in those efforts outside of Rite Aid and Walgreens? And if so, what would that timeline look like?
Yes. So, Connor, we have already been working with independent pharmacies in Maine to vaccinate residents and staff of long-term care facilities. These are skilled nursing facilities and assisted living facilities. And these independent Maine-based pharmacies are working right alongside CVS and Walgreens. Indeed, in recent weeks, given concerns that we've had, we've started working with independent pharmacies even more because they've shown themselves to be able to get in, vaccinate folks, and work through as a complement to the work that CVS and Walgreens are doing. After we have worked our way through the need to vaccinate residents and staff of long-term care facilities, we look forward to continuing to work with independent pharmacies to administer vaccine in different venues across the state. That may be at large-scale community vaccine centers. It may be through mobile applications. It may be on site at different places. So we have really valued the partnership we've had. Just last Friday, I had a call with some independent pharmacists to thank them for their partnership and encourage them to stick with us as we move into the next phase.
Thanks, Dr. Shah.
Thanks, Connor. I'm going to turn it over to Megan at WMTW next.
Thank you, Dr. Shah. Just to clarify, because I think a lot of people, as we can see by how overwhelming the demand has been on certain providers, that there's just a little bit of confusion. I just want to clarify, the original directive was to sort of wait for your provider to contact you, but with the launch of the phone number, the phone line, I guess what you're saying is it's sort of a combination. So if you can't get through, you may be contacted by your provider in the meantime.
That's right, Megan. It's a bit of both. Some folks may get a phone call from their provider before they were able to get through. Other folks may be able to get through. It's two-way traffic. It's bi-directional. And what we don't want, we want folks to get their schedule. We want folks to get their date and time at which they will be vaccinated. But right now, there's just not enough vaccine. And what we're hoping to do is to try to avoid a little bit of pressure on the call centers and trying to let folks both wait to be called if that works for them. But if they really don't, then try to get through one of the phone numbers that's on, but recognizing that every single time you're calling, there's a lot of other folks that are trying to do the same thing, and that just increases the likelihood that you may have a long wait time. So it's both. Both options are available. We ask folks to do which one is best for them.
Okay, and if I could follow up, it sort of kind of stems from that as well. We have a lot of viewers that are in New Hampshire that may actually get their health care here in Maine. So where should they go? Or vice versa? So if you live in Maine, get your health care in New Hampshire, or vice versa, where do you go?
So I'll answer that one. Having talked to my counterpart in New Hampshire on this very topic recently, whether we like it or not, the vaccines are being allocated to states based on the number of residents in a state. So Maine is getting a share of the available vaccines based on the 1.3 million people who are residents here. As such, states like Maine and New Hampshire are advising their residents to get vaccinated in their state. There are sites in Maine that will be open to residents of Maine who have providers in different states. We urge those residents of Maine to look for a site here in Maine where they can get vaccinated, and the same is holding true in New Hampshire.
Okay, thank you.
I'm going to turn now to Dan at the Maine Beacon.
Hi, Dr. Shah. This is for you as well as Commissioner Lambrou. So the Biden administration has filled in some of the details for their plan for vaccinations last Friday. I don't know if you've had a chance to look closely at that, but I was just wondering what are your kind of like top line thoughts, and do you think it will help speed up vaccination in Maine?
I'll start just very quickly by noting what I mentioned in connection with, I think, Joe's question, which is we've had conversations with the transition team. We look forward to having continued conversations with the administration to flesh out the details, and that's where the conversation is at right now in terms of those very nitty gritty, detail oriented discussions. But Commissioner, I'll turn it over to you.
Look, I think we're very encouraged. The plan offers a clear vision, which has been important. As a reminder, the previous administration had told all states to come up with their own plans, gave them a template, and asked them to do it themselves. Here we see a more defined shape for who should get vaccinated and how it will happen. Secondarily, you see some assistance for states that we haven't seen before. For example, there's some discussion in this document about the federal government helping to set up these large volume community testing sites. And third, we'll be able to have greater support for testing and contact tracing in the response, because one of the realities of this period of time is that we're doing both. We're not just trying to vaccinate all people in Maine and all people in the United States, but we're also trying to combat this increase in COVID-19 that has hit Maine in the last 6 weeks, as well as many other states. So we're grateful that the leadership appears to be coming with a plan, with support for states, as well as a recognition that the fight to prevent COVID-19 from spreading continues as we are turning this corner and trying to vaccinate all people.
Okay, thank you.
I'm going to turn over to Ann Burley at the Ellsworth American next.
Hi, thanks for taking my questions. I have a question from a reader that I think is for Commissioner Lambrou. And he asks, given the disturbing number of students currently failing at the high school level, and given the fact that vaccine will not be provided to children under 18, why are we not moving to return all students to in-person education?
I can say on behalf of Commissioner Macon of the Department of Education, as well as Governor Mills, we value in-person learning. We are striving every day to do what we can to keep schools safe so that children, especially young children for whom evidence shows in-person learning matters even more, have the opportunity to be in classrooms. That has meant, and we feel quite proud of it, we have done aggressive contact tracing, aggressive protocols for our schools, and Maine has done quite well in terms of keeping the rate of COVID-19 among people in schools at a rate that last time we checked was about 26% of the statewide rate. So we have done well in trying to keep the spread of COVID-19 down in schools. We will continue to try to do more. That includes looking at more testing options for schools so we can make sure that teachers and staff as well as students are safe. It's looking at how we approach kind of our protocols to see how, do we need to refine how we're engaging with our schools as we go forward. So we take seriously the obligation to do what we can in the state of Maine to keep schools open for in-person learning, and we will continue to do more as time goes on to do better at that job.
Thank you, Commissioner. And then I have a question. So many great information and questions and answers on vaccinations that answered my question, but I would like an update on the outbreak at the Northern Light Maine Coast Hospital, if you have that information.
Sure. Let me pull up the latest numbers there. While I am doing so, I think one important note when folks hear about outbreaks in hospitals, it immediately, I think, for a lot of us, conjures up concerns. It may sound as if how can it be possible that there would be an outbreak at a hospital? What we've seen over the course of the pandemic is that outbreaks at hospitals can occur. They can sometimes be the result of staff who may have, say, contracted COVID outside of the hospital setting, maybe having lunch with a colleague at the hospital and accidentally transmitting it in that setting. Outbreaks at hospitals do not mean that hospitals are unsafe, for example. They mean that hospitals are, in some cases, like other workplaces, which is to say, they have the possibility of having cases within them. Now, with respect to Maine Coast Memorial, right now we are aware of 6 cases associated with that facility. Our outbreak investigation continues to try to learn whether there are others and whether more testing is indicated. We've got a team of medical epidemiologists who focus, at least one in particular, who focuses on outbreak investigations in facilities like that.
Thank you, Dr. Shah. That's all my questions.
All right, thanks, Ann. I'm going to turn it over to Patrick Whittle next.
Thank you very much, and happy Tuesday. So I just wanted to follow up a little bit more about the expired is the wrong word, but the doses that exceeded the temperature. These were headed to 35 locations in the state. Is that right?
That is correct, Patrick. They were destined for and did arrive at 35 locations across the state. And at all of those, we found that the monitor on the outside of the box that has probes that monitor the internal temperature, not just in the immediate temperature, but throughout the journey. They had all shown what are either called exceedances or excursions of temperature.
And where it happened along the supply chain as of now is still subject to investigation.
That is correct. You are correct, as is the root cause of this. And again, that investigation is being led by Operation Warp Speed, the manufacturer, the US CDC, as to get to the root cause of how it occurred and obviously to prevent it going forward. Patrick, I just want to really underscore it. The system is designed with these checks in mind, so that if vaccine experiences these exceedances, everyone is notified. It's right there on the top of the box with a red X. To the earlier question from Amy Brown, so no doses are used from that. And this is part of the system to make sure that doses are not inappropriately used. Now, we are working to pull the data, well, the US CDC and Warp Speed are looking to pull the data and then compare it against the manufacturer's data to see whether the vaccines are viable or not viable.
So that leads into my next question, which was that these could potentially still be salvaged.
That is correct. That is correct. We are awaiting the results of that investigation. Again, Warp Speed, CDC, the manufacturer, are looking at the scientific data on what is called the stability of the vaccine to try to understand whether the excursions or exceedances were such that the vaccine can still be utilized and is viable, or alternatively is not viable.
Is it possible to know how long it'll be before we know that?
We've pushed them on that this morning. I don't have an estimate, Patrick. I asked the exact same question, which is, what will you know and when will you know it? And they didn't have a clear answer on that.
Got it. Mm-hmm. Is it possible to speculate at this point when there could be a sort of a queue system or a sort of a kind of a planning system for folks who are younger than 70 who are in phases beyond 1B, or are we not there yet?
So, sort of what we are working on that internally. What we're calling, you and I talked about this, I think a week or two ago. Initially, I think you and I thought of it as a waiting room. We're thinking of it as a pre-registration. We're working to bring something on. I will tell you the thing that I've pushed my team on is making sure that pre-registration information, that we don't just collect it, that we do something with it. I'm aware of another instance in another jurisdiction where the information is collected, but when I pushed my counterpart about what would be done with that, the answers got a bit murkier. And so I want to make sure that not only are we providing a platform, a venue for that pre-registration to occur, but that we then do something with it. We follow up with folks to say, hey, thank you for pre-registering. Here is a place that you can now officially register. or we've got a spot for you in the zip code area, generally speaking, that you gave us. So that's the piece that I want to work out and play the chess game through to the end.
Got it. Thank you very much.
Yep. Over to Patty White next.
Thanks, Dr. Shah. I've got a couple questions, but just quickly to follow up on Patrick's questions. Do you know how many states had a similar issue with the Moderna vaccine?
Not exactly, Patty. We asked that this morning. I am aware that at least one shipment in Connecticut, one box of 100, experienced a similar exceedance or excursion. We also learned from Operation Warp Speed, and I'm just going to quote what they told me just from my notes, that quote, any event, a couple of other regions across the country had the same experience yesterday as well. I didn't get a readout of exactly which states or how many regions, but I understand that it was not isolated to Maine. Whether Maine experienced it in greater volume relative to our total number of doses, or whether it was on par elsewhere, I don't have that information. I sent out an email to a number of my colleagues across the country, and I haven't heard back from all of them yet.
Okay, thanks. And I wanted to check on the status of second doses. On Friday, we learned about the lack of a federal backup on shelves, and you said at that time you weren't worried about that affecting our supply of second doses. Are you still feeling confident about that?
You know, I'm going to go back and underscore that we are awaiting conversations with the incoming administration after they have had a chance to fully analyze what the supplies on hand are and what the production ramps look like. I did have an opportunity to have a call with someone who's involved with vaccines on just over the weekend, and this individual indicated that they don't foresee challenges, but they too are waiting until they have access to all the data. So I think my answer at this time, Patty, is still the same until and unless we get new information that changes that.
Okay, thanks. And then one last question. So far, we have one major health system that's already moved into phase 1B, and there are other hospitals that are preparing, but they haven't gotten there yet. Do you have any insight as to why, other than supply, and is the state able to step in and help get any of these clinics up and rolling?
Sure. So I'll start. Patty, I think it's first important to just recognize the massive logistical undertaking this represents for everyone, systems, clinics, the state. We have to have a way to both first identify who we are talking about, then we have to have a way to notify those individuals, say 70 and older, and then we've got to have a system to actually vaccinate them. All three of those in and of themselves are massive undertakings, but in concert with one another are on top of the strain and the stress that healthcare systems are already under. It's quite significant. Some of the challenges among many have been having a scheduling system in place that's easy to use, then having a call center adjunctive to that scheduling system for those for whom scheduling online is not an easy or accessible thing to do. It's also, there are these really difficult challenges around scheduling. Every person that is vaccinated today, depending on which vaccine they get, needs to come back at days 21 or 28. If you schedule people for the next 6 weeks or 8 weeks, where are those second doses going to be slotted in? So the system has to be structured such that there's ample time for first doses as well as second doses. If you pack out your schedule for the next 21 or 28 days, then you've already committed your schedule for the subsequent 21 or 28 days because you've got to give everyone their second dose. We at the state level are supporting all of these systems as much as we can. The biggest constraint on the system right now continues to be the supply of vaccine. As the commissioner noted, we received for this week approximately 18,000 doses, 4,400 of which were needed to be put on hold until we can determine their viability and get replacements. That alone meant that as a result, certain folks who may have been scheduled for a vaccination with one of those doses of Moderna may not have received it. The other constraint here is that we don't foresee that supply increasing. And so given that we've got over 190,000 individuals who are just 70 and older. At the current rates, that alone could be many, many, many weeks of vaccination. So there's not one thing that needs to change in order for everything to move. There are so many moving pieces here.
Thank you.
And I'm going to turn it over to Hannah at News Center next.
Hi, Dr. Shah. Thanks for taking my questions. So first, I want to ask, at this point in time, do you have a sense of what percentage of healthcare workers, frontline workers, are opting out of an opportunity to receive the vaccine? And also, do hospitals require their staff to be vaccinated?
Sure, I'll start that, and then and we can discuss the. We've heard varying reports of what the declination rates are have been among healthcare providers. The reports have ranged from system to system, and overall, what I've heard, and I don't have any hard and fast data on this, Hannah, but I can see what we can pull together. I can't promise you that we've got it at the ready, but I'll see what we can pull together. What I've heard has been favorable. We've heard that relative to other states, healthcare providers in Maine have been eager to receive the vaccine. It hasn't been uniformly 100%, nothing ever is. But one of the things that we've been doing is making sure that we are providing education and videos where, for example, my team and I are personally asking healthcare providers to get vaccinated, providing them with all the facts to their most commonly and frequently asked questions to try to get those numbers as high up as possible. As to your latter question, I'm not aware of any healthcare provider that, at least as to COVID vaccination, has required it as part of employment. I know that's a discussion that's been had in Maine and elsewhere, but I'm not aware of any provider that's done so.
All right. And my second question is, as we start to discuss more people becoming vaccinated, wondering at what point, right now we know it's still super important to be wearing our masks, social distancing, at what point does that become less important? And does it directly correspond with how many people are vaccinated?
The answer, Hannah, is that we all want nothing more to get back to that return to normal, and the vaccine will help us get there. When that happens, and when some of the things that, frankly, I think for a lot of us, I was just chatting with some of my team earlier, things like wearing a mask and maintaining physical distance have just become part of our daily lives. When some of those can go back to the way they were before, it's too early to tell. It really, really is too early to tell. There are unknowns still from an epidemiological standpoint, as well as a vaccine standpoint. None of that should be taken to suggest that the vaccine isn't a spectacular technological breakthrough. It absolutely is. There's no question about the value that the vaccine has in reducing or avoiding severe COVID illness. But when that means that we are back to the way we were before, that's an open question, Hannah. It's going to depend on supply, which is what's going to drive speed.
All right, thank you so much.
Let us round out the afternoon by turning to Lauren at WGME.
Hi, Dr. Shah. I just wanted to, I know we touched on this a little bit earlier, but I wanted to see if you could provide some more insight on those that are on border towns of Maine and how they can go about getting their vaccines. We had a viewer write to us and say, my parents both are 85 and live in Kittery, but their doctors are in Portsmouth, New Hampshire. Any suggestions would be helpful.
Sure. Lauren, I think Commissioner Lambrou noted this earlier. Given the way that vaccines are allocated, which is to say 2 states based right now on their populations, that means Maine is allocated, as is New Hampshire, a supply of vaccines each week that is indexed, calibrated to their population. As a result of that, what we are recommending is that Maine residents get vaccinated in Maine, New Hampshire residents get vaccinated in New Hampshire, the same for every other state. Those vaccines are ones that are, again, based on us, based on our population, and given to us on that population. That's one reason why some of the sites that we are hoping to stand up, for example, in Southern Maine, will be open to all, because we recognize that there might be folks in Southern Maine who go across the border for their health care. But we want them and recommend that they be vaccinated here.
And on our website, COVID-19/vaccines, it does, where you have a list of sites that are providing vaccine, have a column that says public. What that means is that people who are not necessarily patients of that healthcare provider can get a vaccine there. So we are working hard to increasingly make sites open to people, no matter where their usual healthcare provider is, because we do recognize that people want vaccines, some people don't have a healthcare provider, and we want to make sure that there's access. I will note that we do hope that as the spring comes, the supply of vaccine is large enough that some of these distinctions are not needed, because our goal is to vaccinate everybody, no matter where they're from, and no matter what their age, no matter what their type of work. That is our goal here in Maine. So we are hopeful that over time, as supply increases, some of these phases and distinctions are no longer needed.
That's right. Let's all hope that at some point this year, if not whenever, the COVID-19 vaccine becomes like the flu shot, where it's available everywhere and supply is not the constraint. But while supply remains the constraint and our supply is governed by the number of people in our state, we've got to preserve our capacity. So with that, I'd like to take a moment to thank everybody for tuning in this afternoon. I thank everyone for the questions. And I'd like to just end on this note. We know that folks across the state are eager and excited to be vaccinated. We can't wait to be able to furnish everyone in the state their 2-dose series of COVID vaccine. We're doing everything that we can to speed up that process, making sure that when doses come into the state, they are quickly moved to sites that can get them into folks' arms. But all of that requires making sure that folks have an appointment. And right now, we know, unfortunately, that there are more folks who are looking for appointments and calling for appointments than there are people to answer the phones and give them a spot on the calendar. We know that process is frustrating for you. I hear that and I get that. My ask, and Commissioner Lambrew's ask, is that you bear with us a bit longer. The system, unfortunately, is such that we knew at the outset there would be more folks calling than there were able to answer. We hope that smooths out as we move through this process. Please don't give up on us. We will be there to make sure there are folks to answer the phones, as well as to try to get you your vaccine as soon as we can. That being said, with over 190,000 folks who are 70 and over to vaccinate, and only about 18,000 doses coming into the state each week, the process will take time. Again, we hear you and we get that, but we ask that you bear with us as we work through this process. We will do everything we can, and our teams will work 24/7 to speed things up as much as we can. It will take time, however. The more that we can rely on you to work with us, the better off we will all be as a state. So with that, thank you all for your time this afternoon. As always, be kind, take care of one another, and we will catch up again on Thursday. Thank you.